Good afternoon. Welcome back to April's seminar. It looks like we've got some more learning to do today. There's a variety of items up here, and it'll be interesting to see how you are going to learn to use them. So we're excited to be here. Remember that this evening from 5 o'clock to 6:45, we will have a professional photographer in the gym, and you can get family photos. Or if you're a single family, you can get your photo taken, right? So come to the gym, 5:45, and you can get your family photo. And then we're hoping that that's just a nice little gift to help you enjoy and memorialize your family and what God is doing for your family here this week at camp meeting. So as we get ready to get started, I'd like you to bow your heads with me and we'll have a word of prayer. Dear Heavenly Father, we thank you so much for the opportunity we have to come together as families, to learn how to help our families, to learn how to help them be in health. And sometimes there are things that come our way in this world that create pain and suffering. And if there are things we can learn to do to relieve pain and suffering, we know that we're following your example because you did that when you were here on earth. So we ask for your presence today, your angels, your Holy Spirit to be with us, to be with April as she speaks to us. Give her the words that you would have her say. And we just thank you again for this opportunity. In Jesus' name, amen. All right, April, come on up.
Good afternoon again, everyone. And I just realized I don't have a clicker. So welcome back to this third seminar here on some healthy natural remedies for you and your family. Today, like I said yesterday, we're going to be talking about some poultices. Now there is all kinds of poultices that you can do. We're just going to be doing 4 of them here to give you an idea of what they are and how to use them and all of that. Thank you so much. To get us started, I do have handouts for this lecture as well. Do I have 2 volunteers that would be willing to help distribute these to all of you, please? And then you can just give me the leftovers. And if there are some here that didn't get handouts from either of the 2 previous days, I do have extras, and so you can come see me afterwards, and I can give you those handouts as well if you're interested. So, poultices. How many of you know what a poultice is? How many of you don't know what a poultice is? Okay, and the rest of you just don't like raising your hands. Okay, gotcha. Okay, so again, I'm not a doctor or nurse. I can't diagnose, but I can share things with you and what I would do if I had issues going on that you might ask about. All right, so this quote from Ellen White is one that applies to many different natural remedies, including poultices. Natural means used in accordance with God's will bring about what kind of result? Supernatural results. You know, I always like to encourage that the most important part of any treatment that you do or natural remedy is praying and asking God's blessing on it. And because it is natural, we're going to be talking about onions and potatoes and ginger and charcoal today. Those are pretty natural things, right? They're things that God gave us. And so we can ask with confidence for him to put his blessing on that. So always pray over treatments, hydro treatments that you give, poultices, or tomorrow we're going to be talking about herbs, any of these things, because he can bring about supernatural results with it. And I have personally seen that over and over and over again in the work that I've done at the Lifestyle Center for the past 14 years. And I'll be sharing some of those stories as I'm demonstrating these poultices to you. All right, so what is a poultice? There's different definitions, but basically soft, moist mass of material, some kind of plant material that's applied to the body to relieve soreness and inflammation and many other things, as you'll see by the end of this. And that's kept in place with a cloth. So it's really very, very simple. Children can make poultices and apply them. So I'm going to not only make a few for you, but also ask for some volunteers that I can apply them to you, okay? Whether you have an issue going on, maybe you do have an ache or a pain on an elbow or a knee somewhere that I could wrap one on you, and you'd be willing to come up here and let everyone see me do that. Or if you just don't have anything going on and you're willing to donate your body part so that I can apply it to you, okay? It's temporary, all right? So as I mentioned, we're going to be talking about onion poultice, ginger poultice, potato poultice, and charcoal poultice. And is there anyone here that has utilized any of those specific ones? Okay, so quite a few of you, a lot more than you raised your hand the first time. Very good. So this is what we want to do. I'm not going to actually make the onion poultice because I didn't really think that you would all appreciate me smelling the room up with onions and making your eyes water, but I am going to be making the other ones. So we're just going to talk about how to do the onion poultice. So there's cooked onion poultice and raw onion poultice, as you can see there on your handouts. And for the cooked onion, that is used for earaches and ear infections and for boils. Okay, so for both of those, you prepare the onion in the same way, but then you use it differently, a little bit differently, depending on if it's for the ears or for a boil. So what you're going to start with is you want an onion. It doesn't matter what color necessarily, but the stronger and more pungent the onion, the better. The more effective it will be. You don't want those real sweet, mild ones for this type of treatment. You want the more pungent ones. And you're going to prepare it by either wrapping it in some foil and then baking it in the oven until it's soft. And how long that takes all depends on what size the onion is, okay? So I can't give you a time frame. You just bake it until it's soft. Or you can put it in a steaming pan and steam it until it's soft. But you keep it whole and in the skin. You do not cut it before cooking it, okay? So that is to retain all of the onion properties in it. We don't want to cut it open and then boil it in water because all those sulfite compounds that we want to use in your ears or on the boil, we want to hold that in the onion and not be losing it out into the water, okay? So either bake it in the foil or steam it until it's soft. Then what you're going to do once it's ready is you'll want to protect your hands because now this is very hot, right? And so don't want to burn yourself. You're going to cut it in half crosswise so that when it's in half, you see all the rings, okay? So then you're going to have two halves. And what you do for the ears is take like a dish towel or a hand towel. We're going to just pretend this is a towel. And you're going to wrap one of those halves in that towel, several layers, until you have enough layers to where you can put that onion directly on your ear, okay, right on the skin without burning it, okay? Something you can also do before wrapping it in the towel is once you have it cut in half, you can take just a regular eating spoon, not a measuring spoon, but squeeze some of that onion juice into the spoon and let it sit there for a few seconds to cool off a little, and then pour that onion juice in that affected ear, and then take your wrapped up half of an onion and put that over your ear. And you're going to wear that for several hours, okay? And if you want to be walking around with it, you can wrap something around your head, like you see a little boy in the picture. He's got that wrapped around his head to secure it there so he can be up and around. Or if you're going to lay down with it, you don't have to wrap anything around your head. You can either lay on top of it to help things drain out, or if that's uncomfortable, you can lay with it just resting on top of your ear. And that's going to be drawing out what's causing your earache or drawing out the infection. It works very, very well. I don't know if many of you might listen to Barbara O'Neill. She talks about these kinds of poultices as well, and she gives stories about people and doing this. Sometimes you need to do it once. Sometimes you might need to do it 3 or 4 times. You basically keep doing it until the pain goes away and stays away. There was one lady that Barbara talks about who she had a bad earache, and she would do this treatment and it would give her relief, but then the pain would come back the next day. So she did the treatment again the next day. It gave her relief, but it came back the next day. And it kept doing that pattern until a whole week. She kept applying that once a day, and after that week, the pain went away and it stayed away. And so it just depends on the severity of the issue going on. So the thing to be mindful of is if you do a natural treatment, whether it's this onion poultice or something else, and you get relief from it, that's your body telling you, yes, this is good, keep doing it, okay? And so just because it's not one and done all the time for natural things. Sometimes you have to do multiple applications. And so you would just keep that on there for several hours, basically until the onion is completely cooled. And as it gradually cools, say you have several layers of towel, as it cools down, it doesn't feel a comfortable hot anymore, so you take a layer of towel off, put it back on. Then when it cools down some more, you take another layer off and put it back on until that onion's completely cooled. Then the treatment is over. Now, if you've got something going on with both your ears, you can apply it to both ears at the same time, and you're just going to have some onion mufflers on you there, okay? But if you're only using one and you have the other half of an onion left over, you can't heat it up later and use it to apply again. That's something that you're just going to need to use in your cooking or toss it, okay? So just to be mindful of that, the onion can't be reheated to be reused later on. Does that make sense? So, and of course the onion that you have used in treatment then is thrown away after the treatment is finished, okay? So for boils, you prepare the onion in the same way. You either bake it or steam it whole in the skin until it's soft, and then you cut it in half crosswise, and you let it cool a little bit until it is cooled enough where you can put it directly on the boil on your skin without burning. Okay, so again, a comfortable hot, not a burning hot. And then once that half of onion is over that boil on the skin, you're going to secure that down with some plastic wrap, saran wrap, and then wrap it up with an ace bandage to hold it in place. And for a boil, that can stay on there either a few hours or all day. Or you wear it at night if you prefer wearing that while you're sleeping. Depends on where the boil is and if that's going to interfere with your sleep or not. You could do it at night instead and not have to bother with it during the day. But basically that onion is going to be drawing out the infection in that boil. Now this isn't the only poultice you can do for boils. Potato poultice is also excellent for drawing out infection from boils. Charcoal is also excellent for drawing out infection. So, these things can be used in multiple ways. And you can even combine them. For a potato poultice, you could mix some charcoal powder in it and apply that over a boil. So once you know what things do, then you can get creative in combining them to increase their effectiveness. But I'm not going to be going too much into all of that today. So that is for how to use a cooked onion poultice for ear aches and ear infections and for boils. All right, so raw onion poultices is used for respiratory issues, respiratory congestion, and infections. And so it helps in drawing out as well, and it helps in opening up the lungs, and it opens up the sinuses. I have used this myself. I teach on these things, and so when something happens to me, I like to use what I teach and see how it affects me. And then I can give tips as well from that. So this time you don't have to cook it. You just use it raw, and you're going to chop it up nice and fine. It doesn't have to be super fine, but you know, the more it's chopped, the more it releases. And you're going to just take a paper towel. You can see there on the handout that there is the raw onion poultice either on the chest, on the neck, or on the feet. So we're going to start with the chest. That's the first one on the handout. So you take your chopped onion and you're going to pile it in the center. I have a couple of sheets of paper towel up here, and I'm going to pile it in the center, and I'm just going to fold over all 4 edges to hold that onion in and contain it. And so since this is for the chest, it's going to be, you know, a fairly good size. It doesn't have to be huge, but something like that, where the onion is contained inside this paper towel, and this side is going to start feeling wet from the onion juices, and that's what's going to go on the chest, on the skin. Now, if you have sensitive skin, which I found out from doing this treatment that I do, I found that the first time I did this, because I was sick with something that had me super congested, I wasn't sleeping well at night because I couldn't breathe well, and I was coughing and all of this stuff. You know how it interrupts your sleep when you can't breathe through your nose, right? And of course, coughing interrupts your sleep. And I think after a couple of nights, it dawned on me, onion poultice, duh. So I chopped it up, got it ready, put it on there. Wow, that just opened up my lungs, opened up my sinuses. I did it right before bed, and I slept beautifully that night. And my sinuses stayed open all night. I think that felt so good on there, I kept it on for like an hour and a half with the heating pad on it, because that can help if you want to speed up the process of warming up the onion a little bit and help it drive it into you. You can do that. So I put that on. Then I had some folded plastic wrap that I put over it, and then I put the heating pad on top of that. And I just laid there in my bed for an hour and a half. I didn't want to take that thing off because it was like, oh, this is so good. But it gave me a little rash on my chest. And that's how I found out, oh, okay, my skin's a little sensitive. So I didn't want to stop doing the treatment because I got such relief from it. So what I did the next day was I put a little bit of a thin layer of olive oil on my skin first, and then I just did the same thing. And that time I kept it every day. I did it twice a day, morning and night, from then on till I didn't need it anymore. And with the heating pad and everything, and did it an hour a day, hour each time, and the rash cleared up, even though I kept doing it. So it really helps in protecting sensitive skin. And once you're done with that poultice, then you just take it off and throw it, either throw the chopped onion away, or what I did was I then emptied that chopped up onion onto a plate, and I set that plate next to my bed, and I kept it there until I did another poultice. And then I would throw that onion away, and after I did my chest poultice, I would put that onion on the plate and just keep it by my bed. Because having that is also releasing into the air, and it was helping me. I think that's part of what helped me to be able to keep my sinuses open and breathing through the night as well. So, and that's something you can do even for a baby. If their sinuses are congested, just chop up some onions and set it next to them, but where they cannot reach it, of course, out of their reach, but where they'll be breathing in the properties of the onion through the night, and that will help them with their breathing. So that is a raw onion poultice for the chest. For the neck, it's the exact same thing, except you're just going to make the shape and size of the poultice different. I would just take one sheet, and I would put a strip of chopped onion there, and then you, again, fold over all 4 edges until it's a more narrow, long poultice, basically where it's going to fit your throat from ear to ear, okay? Just right there. And then you fold over some plastic wrap over that, and then tie a sock around your neck or a scarf or just something that's going to hold it there in place. And that's excellent for sore throats. Some people will sleep with that overnight. And again, you just basically would have to do it to see if your skin can tolerate that or not, to have it on for that many hours. Or maybe if you fall asleep with it and then wake up in the night and take it off, it's up to you. But some can sleep with it all night and some can't because of the skin irritation. But at least having it on for a few hours. And that also not only will help with sore throats, but it will help in opening up the sinuses, right? And again, after you're done with it, you toss it. So onions to the feet is something I never heard of until I listened to Barbara O'Neill talk about it. And you wouldn't think about doing that necessarily, as naturally, but I have done it and found that it works wonders. It's a little squishy on the feet, but you know, that's okay. After we're sick, we don't need it anymore, and the squishiness, don't have to bother with it. So, onions on the feet, it helps with reducing coughing from sickness, so that'll help if you can't sleep at night because you're coughing. Get some onions on your feet. She had her grandson, I think it was, that was sick when she was visiting once, and he just kept coughing and coughing after they put him to bed. And I think after an hour or something like that, she was like, all right, get him up. He's not falling asleep. You know, when children aren't sleeping, parents aren't sleeping either. And they got him up, put onions on his feet, put him back to bed, and within 5 minutes or so, his cough quieted down, and he eventually fell asleep. All it is you take 2 produce bags like this, you chop up your onion, and then you put, for an average size foot, it's about 2 tablespoons, so more or less, depending on the size of the foot. 2 tablespoons of chopped up onion in each bag, and then you're going to put your bare foot, the sole of your foot, on top of that onion, and you're going to slip a sock over it and go to bed, 1 for each foot, right? So one thing you will notice, or one thing I noticed fairly quickly, is about 1 or 2 minutes after I'd put the onions on my feet, I could taste onion in my mouth. And that's because the pores on the soles of the feet are the largest pores of the body. And so things absorb actually quite quickly into your blood, can get into your bloodstream through your feet. That's why I say if you know insomnia and things, you can also apply lavender oil to the bottom of the feet, and you can apply this and that to the bottom of the feet. And people think that's the last place because it's like the most calloused on some people, but actually it's because of the larger pores that can get in. So things like pungent things like that, if you put it on your feet, you're going to be tasting it. Same thing with garlic. You can do a garlic poultice, but you need to know how to do it before doing it. But you can taste that after putting it on your feet. So you can do onions to the feet during the day as well. It doesn't have to be at night, but typically it's at night because you're not up walking around on it all the time. Okay? But you can do it during the day. Like, for instance, a story that was told was these 2 ladies that were going to be going to an event about a 4 or 5 hour drive away. Well, on the day of leaving, one of them started feeling sick, and it was a respiratory thing. And so they got onions on her feet, and she had those onions on while her friend drove, and they both went to this event. By the time they got there and arrived, she was feeling significantly better, and she was able to continue on helping out with that event that they went there for. And so she wasn't, they were driving, so she wasn't having to be walking around on the onions. And cases like that can be very, very helpful. And she got it right at the onset, too. The faster you can try to nip something in the bud, the more successful the natural remedy will be. Okay, she didn't wait till she had been sick for a week and then applied. So But even a week later, if you're still got congestion issues, it's going to be helpful. So that is how you can use raw onions, poultice, to your feet. And when you get up, you know, if you have to go to the bathroom in the middle of the night, don't worry about it. It's, like I said, it's going to be a little squishy on the feet, but it's not going to throw you off balance or anything. I've even done this on my mom, who has to walk with walking poles, and it didn't throw her off balance. She was fine, but it helped her with her congestion and opened up her breathing. And so in the morning, I would get up, go into the bathroom, I got a wet paper towel and a dry paper towel, and I took that off and just cleaned off the bottom of my foot and to where then I could get it off my feet before putting on slippers or whatever to start in on my day. And so that is something very, very easy and simple to do. Raw onion poultices either on the chest, the neck, or the feet. Okay? And onion will not burn the feet. Some people wonder that. It doesn't burn the feet. Garlic will if you don't do it correctly. So that's why, but we don't have time to talk about that. But on your handout, you can see that there are other uses for onion as well. It can be an odor absorber by thinly slicing onions and placing it in an area of offending odor, such as if you freshly painted a room, you can place sliced onions in that room and it'll help take up that odor. If you know there's a high mold content in the room, it will also take that on. And I haven't done it myself because I haven't been in that moldy of a place, but I've heard of other people doing that, and after a couple of days or so of the onion sitting out, it's starting to turn black. So very interesting. And like I said, you can use it for a sick baby by putting it next to them out of reach, and you can make a cough syrup with honey and onion. Have any of you ever done that? A few of you. Yeah. It's, and there's things that you can add to it as well, but the basics of it is getting a glass jar, you put in some chopped onion, and then you cover that with a tablespoon or so of honey. Then you throw in a little more chopped onion, honey, onion, honey, onion, honey, until that whole jar is full. And at the very top, you just pour honey over that and put the lid on and let it set for 24 hours. And during that time, all the onion properties are going to be seeping into the honey. And then you strain the onion out after 24 hours and you keep the liquid in the refrigerator and you take a teaspoon of that as a time as cough syrup. Doesn't have the dyes, the chemicals, all the other things in cough syrups that might be undesirable. You can't give it to babies under a year old, again, because of it having the honey. But for children and adults, it works very well. And you just take a teaspoon as often as needed. And you store it in the fridge indefinitely. How long it lasts depends on the quality of the honey that you use. Actually, you do want to use good quality honey, not the cheap stuff that's diluted and everything. The better quality you have, the longer it will last. Okay? And when it goes bad, you'll know it. And just toss it out and make a new batch. But you can add things in there. Like some will add cayenne pepper, some will add a little lemon juice, some will add some peppermint oil to give a menthol effect as well, and those kinds of things. All right, so our next poultice is ginger. Ginger is something that we used at New Start where I worked a lot. We used it all the time. And we saw not just results, sometimes we saw miracles happening with ginger. And this is one of our favorites. Of course, I almost say that ginger, potato, charcoal, and castor oil, I would say, are some of my personal top favorite poultices. But for ginger, super, super easy to make. And you can see there it's used for joint pain and inflammation, such as arthritis, gout, injuries, back pain and backaches, and recovery from joint surgery. So if you remember ginger for joints, okay? It's used a lot for joint stuff. You can use it for soft tissue, but it's mostly on joint. And what happens is a lot of it's used for that drawing out inflammation. The ginger draws out inflammation from the joint. And so ginger itself, you know, is warming, and it will warm the skin, but it will not burn it. But if you have a lot of inflammation in your joint, then pretty soon, anywhere from a matter of minutes up to a couple of hours of application of the ginger poultice, you may start feeling like your skin is on fire. And that is a good sign, because it means that the inflammation is coming out. And so you want to keep that poultice on if you can tolerate the heat. Sometimes it'll get so hot for people that they just, oh, I gotta get it off, get it off. Take it off and do it again the next day, and it'll pull some more inflammation out. And the more you can do it, but if you can tolerate that heat, then I say keep it on for 4 to 5 hours. And as you do, that heat will ebb and wane a bit and go up and down, or it just may stay, you know, a solid burning sensation. But if it's just on that edge where it's burning, but you can take it, then leave it on there for the 4 to 5 hours, and then give it a break and do it again the next day. And keep doing that until you apply a ginger poultice and you stop getting that burning sensation. Then you know that the inflammation is out. And you'll know too, because your pain is either greatly decreased or completely gone. So we've done this, like I said, probably hundreds of times. We would make them up and fold them and put them in the freezer and have them where we could just grab them real quick. And they defrost quickly because they're thin. Now you just are going to take a piece of raw ginger, and you're going to make sure it doesn't have any mold spots or dirt clumps and things. So this edge, I don't have a knife, but this edge is a little bit moldy, so I'm going to remove that, and I'm just going to grate it right onto a paper towel. You can also get grating gloves, if any of you have those. I like that. That way, if you're using a smaller piece and you grate down to the end of it, you won't accidentally grate your finger and get something surprise into your poultice there. And depending on the size of the area that you need to cover, will depend on the size of the poultice. You know, joints are only so big, but a finger joint or the low back is going to be different sizes, or over a knee or over the ankle or whatever. So I'm just going to do that much. All right, and we're just going to get this all into the center of our paper towel. And you want it to be, about 1/4 of an inch thick or so. It doesn't have to be piled high, but you don't want it too thin. And just like the other ones, you're going to fold all 4 edges over to contain it in that paper towel. And you can already see how nice, wet and juicy that is from the ginger juice. And so you're going to take that, and it's that side, that wet side, you're going to apply to the skin and wrap it up. So is there someone here that is willing for me to apply this to you so that I can show people how to do that? Do you have a wrist or whatever? Okay, thank you. Come on up. So you have your poultice ready. Makes a little bit of a mess with all the ginger pieces going over. So you're going to get a piece of plastic wrap, and you're going to fold it over on itself. That makes it a lot easier to handle. Okay, so once I have it folded over on itself, then it's not irritating and, you know, sticking in places I don't want. So then I'm just going to take that and fold it to the size I want, which is a little bit bigger than my poultice, okay? So I usually do 1 to 2 inches beyond all the borders. And where would you like me to apply it today?
Where do I go?
Do you have a request?
This is arthritic.
Okay.
And this is hurting because of digging clay, dirt.
Oh, the repetitive motion.
So
Okay.
Either one.
Either
Whichever
one.
easier for you.
All right. So let's just do this on your wrist. It's excellent for arthritis. It's the majority of what we use it for, but it'd be good on the elbow too. So I'm going to get an ace wrap ready, and the plastic wrap helps with 2 things. Helps with the juiciness of the ginger, and it also helps with keeping all the properties of the ginger going into her rather than to her and the environment. All right, is that in the right place, or does it need to go? Okay.
Oh, perfect.
And then we're just going to simply secure that on with an ace bandage. Or you could secure it with a strip of cloth, long strip of cloth that you tie together, or a towel that you use safety pins to secure. Anything that's going to hold it on there. Is that a comfortable tension? Not too tight? Okay. And ace bandages nowadays, the handy ones are ones that have Velcro, so that when you get to the end, it sticks to itself there. All right. And there's the ginger poultice. Just like that. Thank you so much. Okay. So, like I said, she's going to wear that for 4 to 5 hours. If it gets really hot, if she can keep tolerating that heat. And again, if she can't tolerate it, then take it off when it gets intolerable, okay? And then just do it again the next day and you'll get more out. All right, so there's other uses for ginger there that you can see, and a couple of tips on your handouts. We're just gonna go on. And ginger is one of those too. If you have sensitive skin, then you might need to put a little olive oil or something, some kind of oil over it first. Just a very thin layer. It doesn't need to be a lot, okay? On to potato. I love potato poultices. And this is something where if you get to using them, you'll probably love them too. It's useful for so many different kinds of things. We're gonna wipe that off, although some ginger in the potato poultice wouldn't be bad unless it was gonna be put over the eye or some sensitive area. But potato poultice is used for soft tissue pain and inflammation, such as all those things there that you can see on the screen. And it is also used for sensitive areas of the body. And it's used for drawing out debris, splinters, heat from burns, all of those kinds of things. So potato draws, and it's made in exactly the same way as the ginger poultice is. So you're going to just make sure you've got a clean raw potato, and it can be, you know, a russet potato or a red potato, golden potato, that doesn't matter as much. And you're just going to simply grate it, skin and all, until you have the size that you need to cover the area and whatever issue it is that you're needing it for. Now, I like to tell specifically 3 stories about potato poultices that was used in different ways. I have a previous coworker of mine who before I knew her, she worked at another lifestyle center, and she worked in the cafeteria. And this one day, she was needing to resupply the cleaning chemical in the dishwasher, and she had to open up a new 5-gallon bucket. And when she did, it splashed some of that chemical into one of her eyes. and she read on the bucket where that could cause blindness. And so what she did was, well, of course, after flushing her eye for 20 minutes with water, she finished her work shift, and then she went home, and she had heard about potato poultice, but she kind of was like, yeah, it's a little quacky, But when this happened, she was like, you know what? What do I have to lose? I could lose my vision. I'm going to try it. And so she made a potato poultice, smaller than this one, of course, and she put that over her eye. She slept with it on her eye that night, and in the morning, there was a little bit of improvement. And it helped because when she got home, her eye was getting red, it was starting to swell, it was hurting, and in the morning, there was improvement in those things. And so she was like, this is really interesting. So what she did for the next 3 days is whenever she wasn't at work, she had a potato poultice over that eye. And after 3 days, all the redness was gone, all the pain was gone, and all the swelling was gone, and she never lost her vision in that eye. And so she was a believer after that. So I've got a nice little pile of shredded potato here in the cloth. And you don't have to use paper towel. You can use actually reusable cloth if you want to. If you've got an old bed sheet that needs to be recycled, you can cut it in pieces and use it for poultices or something like that. So again, I'm just folding over all 4 edges, a nice wet side there with the potato juice. Potato poultices do get quite juicy, and so you do want a good coverage of the plastic wrap to help contain that. And so then the other story was a lady at the lifestyle program. She was one of my clients, and we had an exercise rotation going on in one of the rooms one day, and she was using the stretch bands, and that was connected onto a door, and she was doing some overhead for her triceps, and the band broke as she pulled it out. And it had a little metal piece at the handle that just snapped right on the back of her hand. And it was instantly started swelling and very, very painful. And so right away we got some ice on it. And then as she had that ice on there, I went into the kitchen, grabbed a potato, grated it up, brought it back, wrapped that onto, covered her whole hand there, and put the plastic wrap on it and an ace bandage, and she wore that the rest of the day. The next day she came in for her treatment, and my first question was, how's your hand? And she stuck it out there and she's like, I wouldn't even know it was injured. There was no bruising, there was no swelling, nothing. There wasn't even any tenderness. The only point of tenderness was a little area down at her wrist where we didn't realize it had hit, and I didn't have it covered with the potato poultice, and it just felt like a little bit of a bruise there. But other than that, no injury to the hand. I mean, it was like she hadn't had an injury. And we were all amazed. That was actually my first time to try using that on one of our clients. And she came back to the program like 3 years later or something, and when she walked in, I saw her and she's like, you remember me? I'm the one that hurt my hand and you put that potato poultice on there. I'm like, I tell your story all the time. Because every month when I would give the lecture, I would tell her story about that. And so I'm not going to apply this one, but it's that simple. And it's another story. I love telling these stories, right? So there was this girl, young girl, who got burned on her chest from boiling liquid. I think it was either water or oil, I don't know which one. But immediately after calling 911, her parents knew about using potato for drawing out heat from burns. And so they started shredding up potatoes in their food processor and covering her chest with the potato. And within minutes, those potatoes were hot because it was drawing the heat out. And so then they took off what they carefully could without, all of it, so that they wouldn't accidentally take off some of her skin, and put on more fresh grated potatoes. Within minutes, they're hot. So they, just kept repeating that process. And after about 10 minutes, I think the paramedics got there, and they just kept switching out the potatoes while they were checking her and getting her vitals and all of this and that. And they ran out of potatoes, so they went to the neighbors and got some more and shredded up a big bowl of them and took that bowl with them in the ambulance on the way to the hospital and kept changing out those potatoes when they would get hot. And by the time they got to the hospital, about 45 minutes after her initial injury, they whisked her in, the doctor examined her, and he came out and he looked at those parents and he said, "What did you do? She should be far worse than she is." Because the potato was drawing out all that heat that otherwise would have been soaking down into her and damaging her tissues. And you get it in deep enough and it'll, start damaging your blood vessels and your nerves and different things. And so potato, and all she had was like some first-degree burn areas. And that was it from that severe injury that could have scarred her for life. So potato is amazing. Barbara O'Neill talks about, using it for drawing out splinters and things that she's seen with that. It's just an excellent, excellent natural remedy and poultice there. So potato poultice, easy peasy to do, right? In a matter of less than a minute. And then secure it to you in exactly the same way that I did the ginger poultice on the other lady, okay? So, charcoal, activated charcoal. This is going to be the rest of the lecture time is on charcoal. And I know that there is the senior banquet that starts before this is finished. So if you guys are walking out, I understand that. No offense taken, okay, if you need to leave. Activated charcoal is an amazing substance. It is something that we utilized a lot at the program, lifestyle program as well, in doing charcoal poultices and charcoal baths and taking charcoal internally and all of those things. But I'm just going to talk about the external use of it because we're going to talk about the poultice aspect of it. So activated charcoal there you can see is charcoal that has been treated with oxygen at very high temperatures to make it more porous. This treatment changes its internal structure, reducing the size of its pores and increasing its surface area. Now, the reason that that is important, activated charcoal, increasing the surface area, is because of how charcoal works. Non-activated charcoal is what you see in the fireplace after the wood's been burned. It's just burned wood or whatever, the burned material. Activated charcoal went through that additional process to create more surface area, kind of like blowing ridges and grooves into the substance so that it gets more surface area. And that's important because of how charcoal adsorbs. Charcoal does not absorb, which is the word that most of us are familiar with, like a sponge absorbs water, right? It just takes it up into it. But charcoal doesn't take substances into it, it takes substances onto its surface. And so the more surface area there is, the more it can adsorb. That's A-D, not A-B. So adsorption, charcoal adsorbs toxins and bacterias and viruses and chemicals and poisons and these kinds of things. And so a few charcoal facts. There's, of course, more than this, but this just kind of gives you a good idea of what you would use it for and how it works and such. And that is that it does not expire, for one thing, but you do want to keep it closed, because once you open that up, it starts absorbing things from the air. Okay, so you want to keep it sealed when it's not in use. So you open it, take out what you need, and then close it right back up, okay? And a lot of times there may be a best buy date on it or expiration date on it. That's not necessarily because it expires, it's because it's required by law to put a date on there. But if you keep it sealed correctly, then it will last you decades if you're not using it up, of course. and you don't have to throw it out because, oh, it's past the date, okay? So just be mindful of that. And it may tattoo if it's used on a fresh, deep wound. Now, if it's on a surfacey scratch kind of thing that's gotten infected and you put a charcoal poultice on there, that charcoal is not going to tattoo the skin. But if it's on a deep wound, you just don't want it getting down into those deeper layers of the skin, because once that heals over, you may forever have a black mark there, okay? And a way to prevent that is if you've got a deep wound that's infected and you want to use charcoal to draw it out, I mean, you could use other things to help draw it out, but if you wanted to use charcoal, you would first just get a piece of paper towel, whatever size you need for the wound, put that over the wound, and then put the charcoal poultice on top of that. And that way you'll get the benefit of the charcoal drawing out the infection, but none of the charcoal will get into the wound itself, okay? So just be aware of that. And charcoal also absorbs poisons. They still use it in hospitals nowadays. If you go to the hospital with an overdose, or someone that you know goes in with an overdose, they'll give them charcoal to absorb that overdose and the poisoning of it. And so I wish that hospitals use charcoal more than they do, but at least they use it some. And it is also used for decreasing pain and inflammation. Again, here's another one for decreasing inflammation. And so you can use that on joints or soft tissue, any area of the body that is having that pain and inflammation. And you say, well, which one should I use? Which one is better? There's not necessarily one that is better or worse than another. It's what your body responds to. So for example, knee pain. I have a story where my mother just suddenly started having left knee pain. She hadn't injured it, she hadn't done anything to it, it just started hurting. And I'm like, oh, knee is a joint, ginger for joints. And so I slapped a ginger poultice on there. And it helped, but then after the pain would come back, and I did it again, and it helped again, but it came back again. So I'm like, I wonder about charcoal. So I switched to charcoal poultice, and after one charcoal poultice, it took the pain completely away, and it didn't come back. I was like, okay, her body responded to charcoal poultice better than to ginger poultice. Whereas at work, I had a client who had knee pain. This was not at the same time, but later. And I thought, oh, well, the charcoal worked for Mama. I'm going to start with the charcoal for her. So I put charcoal on her. Didn't really do much. So I did ginger on her, took the pain away. Her body responded to ginger, okay? So sometimes when you do a natural remedy for someone and boy, this is what worked for me, and you do it for someone else and it didn't do so much for them, don't be discouraged. Just find what their body responds to. It might be something else. And so just keep that in mind. So decreasing pain and inflammation. Charcoal also absorbs toxins and infection. I had an infected tooth once, and I have a certain gum disease where I lose my bone, and it's genetic, and so my gums will recede because of that, especially in my top molars. And one of those, my top molar over here, had a lot of gum recession, and so food got up in the tooth, and I had an infection. Well, I called the dentist, and they couldn't get me in for several days. And I'm like, well, what am I going to do? I couldn't eat, it was painful. And I didn't know too much about charcoal at that point, but I did know that it helped with drawing out infection, and I had charcoal capsules. And so what I did is after I brushed my teeth at night, I would stick a charcoal capsule there in between that tooth and my cheek and go to bed. And the capsule dissolved enough to release the charcoal. And in the morning, I would get up and spit it out and clean my mouth out. And I knew something was happening because that tasted awful in the morning. And I am one that sleeps with my mouth closed. I'm not a huh? So if you're one that does that, then, you know, use common sense, safety first. You don't want anything that's going to choke you, right? But this worked for me. And I did that every night until I could get into the dentist. And when I got in there, he took full x-rays because they didn't want to pull the tooth with an infection in there. No infection whatsoever. So because it had the severe bone loss, it was going to need pulling soon anyways, so he went ahead and pulled it. And he looked at that tooth and he said, you definitely had an infection in there because of the 3 roots, 2 of them were eaten almost halfway down from the infection. And so so then I told him what I did with the charcoal, and he was like, that is amazing. I've got to tell other patients about this. So I was feeling pretty good that I taught the dentist something. And so draws out infections, absorbs infections, and it absorbs poisons from bee stings, spider bites, snake bites, mosquito bites, poisonous bites, in other words. And you know, depending on what the bite is, will depend on how much you need and how you use it. You obviously wouldn't use it the same for a snake bite as you would for a mosquito bite, right? A little bit different situation there. But there is recommended reading on your handouts, and in those books, they go into how you use it for, you know, different and various situations and all of that. So I'm not going to go into that. I'm just going to finish up here with demonstrating how to make a charcoal poultice, okay? And I've heard it, going back to the poisonous bites, I've heard many, many stories now over the years of how effective that is for brown recluse spider bites. So I just recommend, I'm not going to go into telling all the stories, but if you ever get one of those bites, use charcoal internally and externally for that until it is completely healed over. All right, a charcoal poultice. There are different ways of making charcoal poultices. Maybe you've seen this way, maybe you haven't. One of the most typical ways is by mixing it with water in a bowl and ground flaxseed or some kind of thickener, and then you put it on a material. And that is a good way of making it, but it is a little messy. So I like this method of making it that I learned from someone else, and I'm going to show you today. So what you need is your activated charcoal powder and psyllium husk powder. I've tried doing this bag method with other thickeners and it did not work, okay? Ground flaxseed did not work even with warm or hot water. And the oat flour, you can use oat flour in the bowl method, you can use cornstarch in the bowl method, but none of those worked in the bag. And here I have some water. So in a quart-size bag, you're just going to put 1 tablespoon each of the charcoal and the psyllium husk and about a 1/3 cup water. If you're doing it in a gallon bag, you just double that. 2 tablespoons of each and about 2/3 cup water. The amount of water can flex because it honestly just depends on how fine or coarse your psyllium husk powder is. The finer the psyllium husk, the more water you might need, and the coarser it is, the less water. Okay, so you would just have to make it and play around with it to see what works for what type you have. And again here, I'm just going to have this over paper towel in case I make a mess. So charcoal can very easily become messy. You have to work slowly with it. It is a very fine powder. You do not want to shake up this bottle before opening it, okay? And we're just going to drop that into there. And another reason I like the bag is because it keeps all that puffy charcoal mess inside the bag. And again, I immediately put that lid back on to keep it sealed. And good, we didn't make a mess. All right, so then once you've got that in the bag, you're going to pour your water. It's just tap water. You don't have to have it hot or cold, just right from the sink. and seal that up and immediately start mixing it with your hand, because that psyllium husk powder thickens quite quickly, okay? And so it's just kind of massaging it there. It's already thickening up. This takes maybe 20 seconds or so before it's nice and thickened. It's almost ready. And again, you don't have any mess on anything. And what you're gonna do, all right, nice and thick. So once I've got it thickened up, I open up the seal again, and I am simply going to flatten that whole mixture out. It's going to fill the whole bag. And once I get it up to the top, then I seal that bag again so that I can just continue spreading it around to where it's pretty much even over the whole thing. If you're OCD, you can use a rolling pin and get it perfectly smooth and even, right? Okay, but otherwise, it won't be perfect, but it fills that whole bag. All right, and so you can, there is your thickened charcoal mixture. And so if it's too wet and gooey, that means you need to use less water. If when you were mixing it up, it just got way too thick and gummy, that means you need more water, okay? So you'll just get the feel for it. And what you do to use this then is always work with charcoal over a paper towel. That's because you don't want to be staining the surface of what you're working on. You also don't want to be staining your clothes, but if you do, I have found the stain remover Shout works excellently. It's gotten it out every time. So to use this, because you can't stick that on you, it's not going to do anything with that plastic on it, right? You're going to just cut whatever size you need to use. Is there someone that wants me to put a charcoal poultice on you somewhere? No, all right. Well, then we'll just demonstrate this. That's okay. I'll make a small one. So I cut the corner out of there, and I'm also going to cut the edges of the bag off. And then I'm going to take that top layer of plastic off. And look at how clean it came off, right? That's because this is a good consistency. And so then what you're going to do, you're going to have your piece of folded plastic folded up and ready to go. That's going to be a little bigger than your charcoal poultice. And you're going to apply that to whatever area. Put that saran wrap on top of it. Get your ace bandage, wrap it on you, and there you go, you're good to go. You're gonna wear that for 3 to 10 hours, basically. And again, that can be put on all over the body. We've used it not just for joint pain, but I've done it for the mosquito bites. I had one of my guests that came in, and her legs were just covered with like 15, 18, 20 mosquito bites. And she was real itchy because they were fresh. And she's like, is there something you can do about this? So I cut little ones, a lot smaller than this, and stuck them over every single one of her mosquito bites, except one we discovered the next day. So I put them over all of her mosquito bites, thought we got them all. She came back the next day, I asked her, how's your mosquito bite? She's like, they're gone, except this one that I didn't realize I had. And that's the only mosquito bite that was still bothering her, was the one that didn't get the charcoal. So then we've had another one, a lady that came to the program with kidney disease. And I forget what exactly it was going on, but the nurse made and put a charcoal poultice across her kidneys, and she had that on all night. And the nurse told me later that when she took that poultice off the next day, it smelled like urine because it was just drawing from the kidneys. They use charcoal in dialysis and filtering the blood is one of the things. but that helps with drawing out toxins from the kidneys. And if you're wearing it overnight, you want to make sure you have it sealed well so that you're not staining your pajamas and your bed sheets, okay? If you're worried about that, then wear it during the day instead of the night. But when you're done wearing that, then you're simply going to remove it and throw it away. What you want to do with this part that you have left over, because you've cut that, now it's exposed, you want to seal it. So I would just take a larger bag and put it in there and seal it, and then you can store that in the fridge for up to 1 to 2 weeks, or if you're not going to use it in that amount of time, throw it in the freezer, and it will last there indefinitely. And it will turn hard because of the water in it, but it's very thin, so when you take it out, it defrosts quickly. Or you can even cut it in pieces, different sizes, and then freeze it, and that way you can just take out one piece at a time as needed. So a lot of different ways you can, things you can do with that. Now, if someone wants to take this with you, you can come up afterwards, and the first one to ask for it gets it. Okay, but you will need to be able to at least refrigerate it somehow. And so if you don't have that ability, then please don't take it. Charcoal, I mean, it can be used in so many ways. I've even used it for my mom's pressure sore or bed sore that she had. She had gotten one pretty bad on her tailbone one time, and it was just continuing to worsen. And we were having the wound care nurse coming out twice a week, changing the dressing and using silver gauzing dressing in there. And I did try some natural remedy of a mixture that kind of turned the area yellow, and the nurse was very mad at me for doing that, because they have to take pictures of it to show changes and stuff. And so I'm like, okay, I won't do that anymore. But I was like, I really think charcoal would help her, because after a month it started to tunnel. It was getting worse instead of better, and it started tunneling. And so then they sent us to a wound care facility, and the doctor there told us that she may need surgery, and this is going to take 6 months to heal, and all this stuff. And so then it was like, I'm just going to try charcoal. It's not, it's not going to harm, and let's see if it helps. And so what I did, now I knew not to put the charcoal directly on the bed sore, so I put it just above it where it was tunneling, and then I had her drinking some charcoal water 3 times a day. And after a month, it was completely healed. Completely healed. And the doctor was quite shocked at that, because he was thinking she's going to need surgery, this is getting bad, and it completely reversed and healed up. And so I could keep sharing stories and such, but I will stop there. So there's the instructions on making what you just saw me do. Again, super, super simple, quick, and non-messy, okay? If you work with charcoal, you will quickly learn that you like non-messy things. But if it puffs up and you breathe it, don't worry about it, because it's not harmful to breathe it into the lungs. Actually, they did some testing on workers, the people that worked in the charcoal factory and were breathing that in. They thought their lungs would be blackened, and their lungs were perfectly pink and healthy. It processes it, so it's not harmful to accidentally breathe it in, okay? So this final quote here says, "Always study and teach the use of the simplest remedies, and the special blessing of the Lord may be expected to follow the use of these means, which are within the reach of the common people." I tell you what, our onions, potatoes, ginger, and charcoal within the common reach of people, within the reach of common people, right? It's not something special. You can go halfway across the world and find potatoes, right? You can go in, these places, and once you know what they do, then you can utilize them. Even if someone doesn't, if you don't speak the same language, if you understand what's going on, you can help them with these things. And like I said, there's a lot more poultices. I teach on cabbage poultices. That's another excellent one to use for mastitis and sunburns. There was one lady who got a sunburn, kind of second degree on her shoulders. Her skin started blistering. And so she made a charcoal poultice just by kind of crushing the cabbage, not charcoal poultice, sorry, cabbage poultice, by crushing the cabbage leaf and putting that on there. And she had it on there for a few hours, and the blisters went away, and that sunburn healed without even peeling. So there's just so many things, and I've had another person tell me how that they would prepare and crush a cabbage leaf and then drizzle some castor oil on it and sprinkle charcoal powder on top of that. And, like I said, once you know how things work and what they do, you can combine things to be more effective and hit different things. So study these things, use them, and as you use them, you'll get more familiar with them, and then you can start sharing them with others, right? And if you don't want to share it with others, you can keep your handouts, make copies of it, share that with them. Get the information out there. People need to get back to knowing these kinds of things, right? Everyone's grandma used to know all these remedies of stuff, but who knows it now? It's a lost art, just like hydrotherapy is, and these other natural things. So there are some resources on this as well, and this is also on your handout that you can see, some books. There are more books on it. These are just the ones that I've read and gleaned my information from, so they're the ones I can recommend, but there's other information there on charcoal. That rxcharcoal.com is a book, but it is also a website. And you can go to it and type in the search bar whatever issue it is that you're wondering about, and it'll pop up whatever articles they have on that topic. Okay, so that's a very good resource to have. And even if you're wondering, I wonder if it would help this, it's worth looking it up. It's worth trying, I say, because charcoal, it's either going to help or it's not going to do anything. So it's worth a try. And sometimes I've done that, and it's like, I don't know if this is going to do anything or not. And whoa, it did. Okay. So you can see some other resources there that you can look up as well. And if you have any questions, feel free to come up. And like I said, if any of you didn't get any of the previous handouts, or you came late and didn't get today's handout, just come up and see me and you can get that. And whoever wants this. But we're going to close with a word of prayer. And again, there's the senior banquet has already begun now, if you want to go to that. And then there's the evening meeting, 6:45. And we're going to come back together again tomorrow. Okay? Let's pray. Our precious Heavenly Father, we thank you so much for these simple, natural means that you have blessed us with, that give us so much benefit to our bodies, and ways that we can wisely use these things. Potatoes and ginger and onions are good to eat, but they're also useful for external issues going on in our bodies, and we thank you for that. And we ask that you would just bless us as we continue throughout this evening, give us your safety, give us good sleep, and bring us all back again together tomorrow, we ask in Jesus' name. Amen.
Do you have the handouts from the?
They're on that. Yeah, they're down there. Oh, okay. And then if you want previous ones, I can get you that as well.
Yeah, the previous.
Just go to get a copy of all your handouts, 'cause I haven't been